Hello, I'm Narav, and welcome to our educational video on non-rebreather and partial rebreather masks. In this video, we'll explore the purpose, components, and usage of these important medical devices. Let's begin. Introduction to non-rebreather and partial rebreather masks. Non-rebreather and partial rebreather masks are vital tools in the medical field, designed for oxygen delivery to patients who require respiratory support. While both masks serve this common purpose, they differ in their mechanisms and their concentration of oxygen that they provide. In this presentation, we'll explore the unique features and applications for these two masks, starting with an in-depth look at the non-rebreather mask. Introduction to the non-rebreather mask. Before we dive into the inner workings of the non-rebreather mask, let's take a moment to familiarize ourselves with its key components. This mask comprises several different essential elements including oxygen tubing, the face mask, the reservoir bag, one-way inspiratory valve, and one-way expiratory valves. Understanding these components is essential to grasp how this mask effectively delivers oxygen to patients in need. Now let's explore the mechanism of action. Mechanism of action of the non-rebreather mask. A non-rebreather mask, which is more commonly used than a partial rebreather mask, prevents rebreathing through a combination of key components and one-way valves. An inspiratory valve sits on top of the bag, allowing oxygen flow during inhalation. An expiratory valve covers the exhalation ports on the mask body. During inspiration, slight negative pressure closes the expiratory valves, preventing air dilution. Simultaneously, the inspiratory valve on the top of the bag opens, providing oxygen to the patient. During exhalation, valve action reverses the flow. Slight positive pressure closes the inspiratory valve, preventing exhaled gas from entering the bag. And meanwhile, the one-way expiratory valves open, directing the exhaled gas out into the atmosphere. It's important to note that while non-rebreathing masks are often referred to as 100% oxygen devices, modern disposable non-rebreather masks typically provide approximately 70% of oxygen. This is due to large air leaks around the mask body and through the open, or non-valved, exhalation port. This open exhalation port serves as a safety feature, allowing air breathing if the oxygen source fails, but can result in air dilution, or leakage, and variable FiO2 wherever inspiratory flow or volume are high. Indications for non-rebreather mask. Now, let's explore when the non-rebreather mask becomes a crucial tool in patient care. This mask is indicated in several critical situations, which are severe respiratory distress or hypoxia, critical emergencies, high concentration oxygen delivery, and patients requiring maximal supplemental oxygen. By understanding these indications, healthcare providers can make informed decisions to administer the non-rebreather mask effectively and provide optimal care to patients in critical need. Contraindications of the non-rebreather mask. As with any medical intervention, it's essential to be aware of situations where the non-rebreather mask should not be used. These contraindications can be classified into two categories, relative and absolute. For relative contraindications, patients who can maintain adequate oxygenation without high oxygen concentrations may not require the non-rebreather mask. It's crucial to assess whether the mask is truly necessary for such individuals. Patients with conditions where high oxygen levels could be harmful, such as certain cases of chronic obstructive pulmonary disease, or COPD, require careful consideration. High oxygen levels can potentially worsen their condition. Patients with severe facial trauma or burns that prevent proper mask fit may not be suitable candidates for this mask, as a secure mask fit is essential for effective oxygen delivery. Now, for its absolute contraindications. In absolute terms, the non-rebreather mask should not be used for patients who cannot breathe spontaneously or tolerate the mask. This includes unconscious individuals, those unable to cooperate, or those with specific medical reasons prohibiting mask use. In situations where cardiopulmonary resuscitation, or CPR, is required, the non-rebreather mask is typically not used, as it may interfere with the resuscitation efforts. Patients with obstructed or compromised airway should not receive oxygen through a non-rebreather mask, as it may impede efforts to clear the airway. Being aware of these contraindications is essential for healthcare providers to make informed decisions about oxygen administration and ensure patient safety. Proper setup of the non-rebreather mask. Setting up a non-rebreather mask is a very straightforward process, which includes ensuring the oxygen source is connected, checking that the reservoir bag is fully inflated, connecting the mask to the oxygen tubing, adjusting the mask to fit snugly over the nose and the mouth, securing the mask with the elastic strap behind the patient's head, ensuring exhalation ports on the mask are open, and continuously monitoring and adjusting oxygen flow as needed. This quick setup ensures effective oxygen delivery. Initial settings for the non-rebreather mask. Now, let's talk about the initial settings for the non-rebreather mask. Your oxygen flow rate is typically set between 10 to 15 liters per minute, but also, a minimum of 10 liters per minute is essential to keeping the reservoir bag properly inflated. The initial FiO2 setting for a non-rebreather mask often falls between the range of 80 to 100%, providing a high concentration of oxygen. For its FiO2 stability, this setting is variable, making it a low-flow oxygen delivery system. The actual flow rate chosen depends on the factors such as the patient's oxygenation needs, age, and the severity of their respiratory distress. Adjustments may be necessary based on the patient's response and oxygen saturation level. Now, let's watch a quick demonstration by my classmates. Afterwards, we'll dive into the partial rebreather mask and its unique features.
Hi, my name is Maria.
I'm Kasey. We're going to be going over a non-rebreather and a partial rebreather. They're going to be demonstrating on me.
Hi, my name is Maria, and I will be your respiratory therapist today. I washed on the way in, and I gloved on the way in. What is your name and your birthday?
Kasey St. John, 12/4/93.
And the physician actually ordered for a non-rebreathing mask. I will go ahead and raise the bag. How are you doing today?
I'm good. How are you?
I'm doing good. And my assistant will go ahead and bring in the non-rebreathing mask.
Sorry.
And what we have here is a flow meter. He will go ahead and plug that into the wall. And we have the Christmas tree that goes onto the flow meter. And the flow range will be 10 to 15. This is the tube that gets connected to the flow meter. And this is the bag with the reserve. This is the mask with the reserve bag. And the FiO2 range will be 80 to 100.
Help you put this on?
Flow rate at 15.
Just to flush it out. We're going to use this to inflate the bag, and once the bag is fully inflated, we're going to turn it down to 10 because that is what the physician ordered.
Introduction to the partial rebreather mask. Now that we've seen how to set up and use the non-rebreather mask, let's shift our focus to another essential piece of respiratory equipment, the partial rebreather mask. Similar to the non-rebreather mask, the partial rebreather mask consists of vital components such as oxygen tubing, the face mask, the reservoir bag, and exhalation ports on the side of the mask. These components work together to provide a controlled flow of oxygen while allowing some exhalation to occur. Join me as we explore the features and functions of the partial rebreather mask. Mechanism of action of the partial rebreather mask. Now, let's dive into how the partial rebreather mask functions, similar to the non-rebreather mask. Just like its counterpart, the mask is connected to an oxygen source, often an oxygen cylinder or a wall outlet. The mask features a reservoir bag that stores oxygen-rich air. This bag serves as a small reservoir of oxygen to enhance inhalation. When the patient inhales, the partial rebreather mask allows a blend of oxygen from the reservoir bag and ambient air to enter the mask. This inhaled air includes fresh oxygen from the reservoir bag along with a portion of exhaled air that remains in the mask. During exhalation, a fraction of the exhaled air is directed back into the reservoir bag, while the remainder exits through the exhalation ports in the mask. This design enables the patient to partially rebreathe their exhaled air. Importantly, the partial rebreather mask provides a higher concentration of oxygen to the patient compared to breathing ambient air alone. This feature is particularly beneficial for patients who require supplemental oxygen but can tolerate some rebreathing of exhaled air. Understanding this mechanism of action helps us to appreciate how the partial rebreather mask effectively delivers oxygen while balancing rebreathing to specific patient needs. Indications for the partial rebreather mask. Just as with the non-rebreather mask, understanding when to use the partial rebreather mask is vital. The indications for the partial rebreather mask resemble some aspects but are distinct, such as moderate respiratory distress or hypoxia, patients needing moderate oxygen supplementation, situations where high oxygen concentration is not necessary, and conditions where partial rebreathing of exhaled air is acceptable. By recognizing these indications, healthcare providers can confidently utilize the partial rebreather mask to provide optimal oxygen support to their patients. Contraindications of the partial rebreather mask. Much like its counterpart, the partial rebreather mask also has important contraindications that healthcare providers should be aware of. Relative contraindications include patients with severe respiratory distress, patients needing precise oxygen control, and for their absolute contraindications, patients who cannot breathe spontaneously, patients in cardiac arrest or requiring CPR, and patients with obstructive or compromised airways. Understanding these contraindications ensures safe and appropriate use of the partial rebreather mask in patient care. Proper setup of the partial rebreather mask. Setting up the partial rebreather mask is straightforward, much like the non-rebreather mask. You would connect the partial rebreather mask to the oxygen tubing, adjust the mask to fit snugly over the patient's nose and mouth, ensuring a proper seal, secure the mask in position by attaching the elastic strap behind the patient's head, ensure the reservoir bag is not fully inflated because this allows for partial rebreathing, which is a key feature of this mask, and also continuously monitor the patient's oxygen saturation and respiratory status and be prepared to adjust the oxygen flow as needed to maintain optimal oxygen levels. This simple setup ensures effective oxygen delivery while allowing for partial rebreathing, making the partial rebreather mask a valuable tool in patient care. Initial settings for the partial rebreather mask. Just as we've seen with the non-rebreather mask, setting up the partial rebreather mask involves specific initial settings, such as the oxygen flow rate, which typically is set between 10 to 15 liters per minute, with a minimum of 10 liters per minute to keep the reservoir bag properly inflated. As for the initial FiO2 settings, the initial setting for the fraction of the inspired air is usually around 60 to 80%. This provides a controlled level of oxygen supplementation. Like the non-rebreather mask, it operates as a variable FiO2 stability, making it a low-flow oxygen delivery system. The choice of flow rate is influenced by factors such as the patient's age and condition. The goal is to provide adequate oxygen supplementation without causing discomfort or potential harm. By understanding these initial settings, healthcare providers can ensure that the partial rebreather mask effectively meets the patient's oxygenation needs. Now that we've discussed the initial settings for the partial rebreather mask, let's take a brief pause and allow my classmate to provide you with a quick review of both the non-rebreather and partial rebreather masks.
Alright, we're going to be going over the equipment we use for this treatment. First, we have the non-rebreather mask. This also doubles as a partial rebreather once you take off the valves you see here. Alright, and now we're going to need the flow meter, which is right here and measures the flow of oxygen delivery. And you could, change this stuff for you. And we also have the tree that goes onto the flow meter. And we have the oxygen line. Cool. Thank you.
Goodbye.
All right, thanks for watching.
Thanks for watching.
Thank you guys. Have a nice one.
Leaves.